any of the products we talk about in today's video, we will have a link in the description below. Make sure to check it out.
Hello, everybody. I'm Jill.
I'm Shanna.
And we're the Detox Girls, and we're so happy you're here to join us. And we have a very special guest, our friend, Dr. Christina Rahm is with us today. Just briefly, because we are going to go into it more in depth when we're talking with her, but she is a Ph.D., SCI Ed, nanobiotechnologist, and bioscience engineer. And once you understand what a bioscience engineer is, I think you're going to be very impressed. So welcome to our friend, Dr. Rahm. Thank you so much for joining us today.
Thank you. I'm glad I'm here. I actually am finished, I think by December. It's been a 4-year program after my PhDs with the MD program in Africa, where I've helped the governments work on their medical school. So I'm excited when that's done. And that was important to me, not because I plan on leaving what I'm doing right now, because I really am a scientist. You know, I make different formulas and different products, and I've worked in biotech and pharma and nutraceutical and environmental. And that's really where my passion and where I feel like God put me in my life. But I wanted it anyway, because it helps with the credentials worldwide and when I'm meeting with these governments. And so I think it's important for the community, because I've tried to hit as many degrees as I could, not because I want to be important, but because it's important that for me that I know as much as possible so that we can help as many people as possible with solutions throughout the world.
Oh, I love that.
That is exciting. That's actually why we have you here, because we feel like a lot of people don't understand what a bioscience engineer is. We say it, we try to explain it, but maybe you could give us some insight on the significance of what a bioscience engineer is, how few there are that have the ability to do what you were trained with, maybe a little bit on your training and how you have come to do the things that you do now and what you were called to do.
Perfect. Yeah, I'll answer that. You know, this is kind of a sore point for me too, because I've spent so much of my life, you guys know this, I've worked in 88 countries. I've worked with governments. I've worked with corporations in the biotech, pharma, environmental, government world. But it wasn't my plan. You know, I say this a lot. I was an artist that really had fun, and I was in psychology. I did have a master's of science, but I had, you know, the series of events from Lyme disease to cancer, childhood cancer, losing cancer, that really led me to change my life. And it really humbled me. I never had a problem when I was in pharmaceutical or biotech with anyone understanding what I did and where I was from. And even though I really feel like those companies honestly groomed me in a way where I would learn all the science, you know, it was a gradual process where I'm like, wait a minute, why are you guys putting me on stage to train doctors throughout the world? And why are you having me do investigator-sponsored trials? But they sent me back, like Biogen IDIC is out of MIT and Harvard. So our labs were out of MIT and Harvard. And I can tell you this is very hard for people to understand, because you know, you have a lot of doctors that are seeing patients, but truly the people that make pharmaceutical biotech products typically are biochemical engineers or bioscience engineers, or people with PhDs in chemistry. And that really wasn't my background. You know, like I said, it was, they took my master's of science and my first doctorate degree in psychology and counseling and sent me back to school and then trained me in the labs. And to be honest, it was over my head at first. Like, there were 16-year-olds from China in my classes that I was like, they know more than I do. But I felt this desire to, I think, succeed in my career at the time. Also, I felt this overwhelming desire to come up with solutions because what had happened in my life. And, you know, it was when you almost die or when you're sick that much, and then it impacts your family and your children, and you don't know if you're going to be around, you really think, okay, why am I here? And what is my purpose? And I don't speak a lot about my beliefs because I work with so many religions and so many different cultures throughout the world, but I'm a Christian. You know, I have Bible study every day down at the table, but I also am a scientist. And my education, going from a master's of science and a doctorate degree into the top schools of the world like Harvard and MIT, and then later going back to school there and being an adjunct professor at one point at Johns Hopkins, I was really thrown into a world here in the United States where I worked with the top bioscience engineers and scientists, which are very different than most medical doctors. Medical doctors learn to diagnose and treat. They can tell a scientist like me what they think should happen in a lab, but most of them don't work in a lab. They don't have that training. They've never worked with, like, I worked with murine and mouse DNA, and I worked for a long time in that industry, right? So I learned how to formulate things in the United States at some of the top labs and some of the top places so that I could make things more bioavailable. And in the process, I was exposed to working with HIV and a lot of viruses and biochemical, biowarfare, a lot of different things because of the projects that I was involved in. And I remember being thinking, gosh, how did this turn into my life? And I think that's why I started understanding some things we don't plan. Some things just happen. I was never attacked. I was never questioned about an education. And if you really look at it from my viewpoint, I came from a world where that wasn't my intention to be a scientist that did that. And then those companies had me learn all these things so that I could develop some of the top products and be on teams that develop solutions for our world, right? And through that process, of course, I then started understanding how some of those solutions maybe weren't solutions I believed in. Some of those solutions and projects I worked on had side effects that maybe I wasn't 100% behind, but I can tell you my intention was pure. And then the more I grew and the more I learned and the positions that I was put in into influence, I still never was criticized until I left kind of corporate America and did my own thing. And then I noticed other doctors got jealous of me, other scientists, other people, because I do have a pretty long CV. It's hard to believe, actually, I think, for some people, because I think unless you were a person that went through cancer at such a young age and Lyme's disease and lost a child and then had a lot of issues, you would never have put the focus on learning all these things like I did. And it's really interesting because I wasn't shocked like everyone when the pandemic happened. I had worked on projects in other countries throughout the world where we worked on projects, and I knew there were retroviruses. I knew that there were things that could get out of a lab and would hurt people, hoping they never did, but also understanding that countries and governments worked on things to protect their country, right? And so I wasn't shocked because I was prepared, to understand this was going to happen. And then one of the reasons I worked on formulas like Clean Slate and Relive and Restore and Zero In is because I knew that to get viruses out of the body, to get rid of things like spike proteins and to get rid of things that are really attacking the immune system, because we could get into a lot of medical terminology. Like if you really look at my background, I trained doctors and residents, right? I did investigator-sponsored trials. So you could put me head to head with anyone if you want me to talk about scientific words and very intricate understandings of the body, right? But then when I came over to the nutraceutical world, I started understanding I've got to talk and reach a general population. I will say this: when you work on products that are to help with vaccinations or to help with retroviruses, and you're part of a team where you're on the medical, clinical, or research side, and you're traveling throughout the world, and you're on stage, and you're working with the top doctors and scientists throughout the world, a lot more than most doctors, right, that are practicing. You're teaching them, and you're teaching them what you want them to know. And I do think that a lot of your pharmaceutical biotech companies have the intention of helping and saving people throughout the world, and I mean that. But I also think that sometimes money and power get in the way. I think that there's been a plan for a long time, as far as population management was not a new word for me. It's been something I've been around my whole life. Predictive modeling, not a new word for me. I understand that for every positive, there's a negative. But when I think what was different about me is paying attention to working with human monoclonal antibodies and murine and delivery systems and doing all of that, not just in my education, right? But in my training, working with governments and working with the top companies, I was exposed to everything. you'd have to have a career in biotech and pharma and keep going back to school to really understand all that. So if you're a medical doctor and you're teaching in a university, but you're really not doing that, or you're telling someone else what to do, you don't have a thorough understanding. And I'm not being arrogant. That's been my life. So I really worked on a series of things naturally, knowing that we had all these environmental toxins and heavy metals and wanting to help people, knowing that sometimes they would need things like Zithromax or diflucan or certain, ivermectin, different types of medication, but also knowing there was natural things. And then for me, because I traveled to so many countries, because I had had cancer, because I had had Lyme disease, and I wanted to get rid of the heavy metals in my body, and I wanted to help get rid of the things I had put into my body, I knew it was important to develop a product and product lines that could do that. It just so happened, and you asked me, Christina, how in the world did this company launch the month that COVID hit? I want to say this. I have no idea. I know I pray a lot. I know that I was told at a younger age that this was my purpose in life by numerous people. And, some people are spiritual and some people are Christians and some people aren't, but that's the truth. I know I was never criticized until I stepped up and did something different that no one had done. And I know to this day, now there's scientists coming out that really, if you ask me, are they really scientists that go in a lab? Are they really people that have worked and spent their career and understand retroviruses? Do they understand how to work on vaccines? Do they understand how to get rid of things in the body? My answer is most of them don't. Like, even when I see a scientist, I'll be honest, that worked for a pharma company for 6 months in a lab, but they never had this career where they were exposed to everything, because you're segmented out until you get to the top of some of those companies. I don't think they have a thorough understanding. And I actually have a problem with that, because from my perspective, we need to be honest with people. I hate the fact that I was crucified about my education because people are jealous. I hate the fact, because I don't want people to be jealous. I'm not jealous of anyone. I hate the fact that people are willing to say things that aren't true about different formulations. As a bioscience engineer, I went back for 3 years. I was even criticized at one point for my Harvard education, because I went back to the Harvard Extension School and I did a 3-year program where it had to be online and in person. And I had to go in the lab. And at the same time, I was working and traveling throughout the world. It was really hard. And each class, I had to come up with a new project. That's where I came up with really improving what we have today, which is clean slate. That's where I came up with Envirom and skin defense and protecting our largest organ, which is our skin. I did those in that program. And at the same time, I went back to Cornell on their online program, and I did pharmaceutical management, manufacturing, and nutrition. And in my pharmaceutical program, I'm being completely candid, a lot of the people in that were colonels or generals and that were scientists in the military. And we were divided into teams and we worked on projects. They did understand this language. They did understand what I did, but these were men that were at the top of their career, and they were working, with our government military to make sure we had solutions as well. My heart, my desire was to give back from a supplement perspective naturally. I had many offers to do this at first pharmaceutically, and I still do. My issue was I wanted to do something naturally. And I do believe there's a big misunderstanding when people think you can't get rid of things naturally. I think there's a huge misunderstanding when people say, oh, you can't get better or you can't fix this. Like, even with this 5G and the heavy metals and the pollution, we can do things that get rid of heavy metals in our body. The issue is the research and the data, and it's not really there in the nutraceutical space, which is why, the 76 country patient registry that I met with 31 doctors from around the world on this morning is so important. It's really important that we don't try to be a pharmaceutical, but that we try to show the results that are happening, including, I hear all these people talking about the spike proteins. And for me, it's a bigger issue than that, to be honest. I always say, your cancer cells are talking, your energy levels with the 5G that's going to go to 10G, they're impacting your eyes and your ears energetically, right? And that's really easy for a quantum physicist or someone that's in a graduate or Ph.D. level to understand. That's a bioscience engineer or nanobiotechnologist. If they really have the training, they know that. but it's hard to communicate to a mass population because you scare everyone, right? And my intention is not to do that. My intention also is not to bash competition, but to get the real information out there, which is, in order to create a product that's really able to stop that talking and signaling, whether it is taking down a spike protein or graphene or other types of energetic levels that are interfering with our natural ability to be the best we can be and to live, right? And to soar and be beautiful. You've got to use certain solutions from a scientist that understands how to do that. And it can't be pretend science. It's got to be someone that does know how to work in a lab and does know how to work with magnets and polarization and fracking and different energy levels. But the reason I haven't spoken out a lot about it is because, the scientists that have really stepped up have gotten attacked. Then you see people stepping in, I'm just going to be honest, that are on stage and talking that I don't feel like they have the background, and I don't feel like they have the right to say that they do when they don't. But I don't want to argue with them, and I don't want to fight with them. I just want to help people. I want to provide solutions for the world and for people. And I want to do that humbly, and I want to do that honestly. And unfortunately, we live in a world right now, you can say you're a Christian, for example, and maybe you don't have Christian actions. I mean, you can say you're speaking for God, but if you're speaking for yourself and your ego, are you really speaking for God? I'm not here to judge because that's not my role, but I am here to tell you that I don't think there's a lot of true scientists. If you said to me that medical doctors can do that in a lab, maybe if they have a postdoc, Ph.D. in Bioscience Engineering and chemistry, and they've spent most of their life doing that, maybe. I don't know how many of those people are doing that right now, like literally doing it, or are they just saying they're doing it? I'm getting ready in the month of October, which is this month, to go back into 3 manufacturing labs and work on things, because one of the manufacturers I was working with, they don't have the kind of clean room I want. So I'm switching manufacturing. Now, where I am doing clean slate and where I'm doing the other, our products that you guys know of, that we haven't launched, those are very secure. And I did work in clean rooms in all but one of those. One of those I had to do over Zoom while they were in a clean room because of COVID and because of what was happening, and they wouldn't allow me to come in. And it took a lot of time and a lot of work. But again, I don't know if you guys know this. I don't really know the competition. I know everyone else does. I don't. And the reason probably that I don't is I don't feel like we have competition. I feel like we have a solution that no one has. I think other people and companies have solutions that we don't have in different areas. But as it pertains to the detoxification and the cleaning of heavy metals in the body, I really think we have a solution that's very helpful to people, not just from a spike protein or graphene level, but also from a energetic 5G influence level, right? Because that's really important. Your body can only handle so much of an electromagnetic field. You look at pilots, right? And stewardess, they get sick very easy. And it's because they're up at an energy level where they're being exposed to all of these things that are not good for their body. And so I personally, because I used different types of methods that I don't think most supplement companies are familiar with, I don't think that most scientists haven't worked in 88 countries in different labs and in different hospitals and worked on formulas with people. That doesn't make me better. That means that I've been exposed to things that have helped me come up with things that are able to work with people like you all, because I'm just a small piece of that puzzle. I'm the scientist that God put me in situations where I was able to learn all this. And I feel like, how in the world did a tomboy from Dexter, Missouri, that was so unattractive and so such a nerd, because I've always been such a nerd. I speed read. I have an eidetic memory. How did I get into this position that I'm in right now? And the answer is because of people like you, because I I was able to come up with a solution that's able to help people throughout the world. And it really is helping people. It's really going into their body and able to communicate on an energetic level, because I use different types of magnets. I use different type of polarization. I use different types of catalyst that would go in and communicate with the body to help clean it out, and really energetically and from a quantum level and from a scientific level really get into all the different parts of the body. I have to be extremely careful when I talk about liposomes and nanobiotechnology and delivery systems, because this is a nutraceutical world. But the truth is, that's a world I've always been in, and I have either learned in that world or taught in that world even, right? And so, I'm protective of what I say and what I do, because to me, it can't be my ego with me saying I know more or that it's better. It has to be letting a product speak for itself. But where I do have a problem, like I said, is people saying that they have a solution that I don't believe they have.
Yes, I would agree. I think one of the things that Jill and I love about you, whenever we started when we met you so many years ago, we started learning about you and became friends, is the fact that I see it as, the Lord calls those and he equips them. He doesn't call the equipped. He equips those he calls. And with your background and wanting to be you wanted to be a missionary whenever you were a teenager, you wanted to serve the Lord and everything, and you are. And I see it as kind of like a modern day thing that we don't see very often, similar to, Saul before he became Paul. He was one of the Pharisees. He was going to be the next high priest and everything. And the Lord called him out of that, and then he equipped him to go in and minister to the Gentiles and start the church. The Lord does that. So it's pretty rare that the Lord does that, but when he does that, it's very astounding. And I know you were so very humble and you never talk about it. So that's why I wanted to mention it, that the Lord equipped you through everything he called you into and made a way for you and broadened your path to be able to learn all these things, because he called you into this. He calls those, he knows the plans of the enemy, and he always has, the chess piece to play ahead of them. And you are one of those chess pieces, and we really do believe that. And so we want to thank you for everything that you've done, and we really want to help people understand the significance of what a bioscience engineer does versus a lot of marketing and a lot of new shiny things and a lot of things that pop up, especially with social media, because you have to be so careful, and it's very important for people to understand the significance between the two.
Yeah, I was from a world where I wasn't even allowed to be in social media when I was in biotech and pharma. I was a CEO of a healthcare. This isn't a secret. I was, CEO of a healthcare company that was in all 50 states. I did research, everything from Mayo to Cleveland Clinic and to Hopkins and Harvard. I mean, we did projects everywhere. But I kind of think my story, when I was younger, the prophecy over me was Esther. But if you ask me personally, because I do think this is kind of a story of someone that wasn't equipped, like you said, that God said, this is what you're going to do. It makes me kind of cry, because it definitely wasn't something I wanted to do. And I have to tell you, I think my story is more like Job. I've made many mistakes. I've done a lot of things. My heart has always been centered on God. I think his heart was too. But I had a lot of stuff taken away from me at a very young age. I was married to someone pretty famous. We were kind of the perfect couple. We had a lot of money, had a lot of influence. And I had this at one point in my life, a person that was such a strong Christian. I accepted Jesus Christ and God. I heard him speak to me when I was little. I mean, I was 5 years old, a little kid, and I just knew my passion, my path, my love was Christ, and that would be my only love. I have to be really honest. In my heart, when this happened at a young age, I really didn't have a desire to get married or even have my own children. I wanted to be a missionary. I wanted to serve. But you get lost in life sometimes, right? And so there was a point in my life where I probably had almost everything. And I remember getting a lot of recognition actually for being a female CEO in healthcare. And I remember being a little arrogant. I remember thinking, I don't need to ask God, for guidance. I've got this. He's already given me the tools. I've got it. And I lost pretty much everything. I was in an abusive relationship. My kids were hurt by it. We lost a lot of money that we had because it was, just everything was kind of taken away. And God really spoke to me during that time. And he told me that he had plans for me, and they had been plans that he had for me since I was little, since I was born, before I was born. And I really leaned on that and listened to that. And, I hear people say they pray an hour a day. I mean, I think you guys know this. There's some days I pray 4 hours a day. And when people say to me, you got to pray about this, I'm like, don't worry. I'm never going to make the same mistake again. And God, that's why there's not a reason to be jealous of me. I've had so many types of cancer. I've been impacted by extreme pain and lost everything. And God has really, as he does for all of us, he's our salvation, and he had better plans for me than I had for myself. He had plans for me to be more than a wealthy wife that had influence. Not that those plans are for certain people and it's great, right? Because I do believe God can use that just as much as he's used me. But he had this plan, for me to use the brain he gave me, to use the abilities he gave me to really create something for a time like this. And he did not put on my heart that I needed to be arrogant. He actually did not put on my heart that I needed to be on stage. He put on my heart that I needed to be humble, and that I needed to understand that he would protect me even when I'm, was scared. And that's happened to me because I've been, like I said, when it was so interesting when, I don't know if you guys know this, but the month COVID hit, Clayton launched Root, and I got sued and had not been sued, right? It was like I was attacked left and right, and then another lawsuit and another. It was like I was just attacked for doing what? For creating formulas. So you would think, why is someone being sued for creating formulas that aren't even out there yet, right? But it's because these are so important into helping our world and really helping us get to another level. Because I'll say this, our world has changed. It's not going to go back. So we either lean on God for those answers and we go into certain solutions. And there's so many days, and I want you guys to know this, that I don't even know my parents believe in me, because it's not that they don't love me, but it's hard to understand the path that God has put me on. But he's really my only parent. He really still is my true love. And it doesn't mean I don't love Clayton or you all are my kids, but he's my one true love, and he guides that. And so no matter what happens, I have that faith, and that leads me, not to lie, not to have to exaggerate something, but to tell the truth. And the truth is, in order to get rid of things in the body that are like heavy metals, whether it's graphene or spike proteins or 5G or different things, you've really got to break that. And I'm going to say noise, right? Or energy. To me, it's so simple too. It's like there's good and bad energy. There's God, there's Satan, right? It's just the truth. I mean, we can go around it and say, I hear people say they don't believe in Satan and evil. And I'm like, well, let me tell you this. If you're going to believe in God, you need to understand that there's the opposite. Same with energy levels. So I really lean into that. And I know this is hard for people to understand, because I went back to school and back and back and back and back again. I mean, I really did. I stayed, I did Perry programs, I did international programs, and then I was criticized for it. And I would say again to you all, why would someone be criticized for an education that's gone on 25 years? And it's because it's a threat to be able to develop solutions that can help the land, air, and water and people get rid of nuclear waste. It's a threat to be able to regenerate something, and everyone wants to own it. But the truth is, no one owns it. It really is owned by God. And so that's the salvation in all this for me. I think the hardest thing has been hearing people step up that say they're Christians and then acting like they have a solution that I'm not sure they even understand what they're talking about. And again, that's me saying that without judging that, right? That's just me not understanding it. I think Root is in a great position because we have people like you all that are willing to be strong. You guys are willing to not listen, to all of the outside noise. And I think you've learned that like me because you have your eyes on something much greater. And I think that that's really probably my answer to people. Yes, I'm a bioscience engineer. I actually did 3 years postdoc at Harvard and got a graduate certification, and they don't even have the program anymore in nanobiotechnology, right? And that was not an easy program. You could not make below a B or you were kicked out, right? And so it was hard and it was a lot of work, but it was so good for me to learn because I went back specifically to figure out how to make the things that we have at this company better. I did. I went back specifically, and if people are jealous of that, then they should have gone back to school like me and learned to do it. I always say to people, don't be jealous. Go do something better than me, which is great because I think we all have the potential. But I hate that you guys, I hope that we're able to really get the case studies and the patient registry and the new trials that we're getting ready, that we're running, in the United States and in Romania. That's one of the reasons I was in Parliament in Romania. I hope we're able to get that information out there to help more and more people, and we will be able to. But I don't think it will be the end of the criticism. And I don't like it when I read things like I do. Let me say this. So like we talk about skin defense, right? That skin defense is like a different variation of clean slate with iodine added and hypochloric acid, which is traditionally a pharmaceutical product. And I say this, I can't use that in an IV or an injection, but in case of an emergency, like that would be something I would be leaning on for my family, right? Because it has ingredients in it that are really able to help, again, rip apart certain particles or heavy metals or certain things that have gone into our body with what I think is the intention to destroy our bodies. I think it's a dark force and an energy. Honestly, I think middle-class America does not want to deal with it, including me. I don't want to deal with thinking that something could be so corrupt and bad. But I think there are some people in this world, unfortunately, it's not a lot, but there are some people that have misguided us and are continuing to misguide us. And I do think that one of the solutions is clean slate and skin defense and zero in and different things that we have that can really help people energetically, spiritually, mentally, emotionally, and physically. Because for me, when you have God on your side, and that's your true love, it's endless possibilities, right? So if you're being attacked, then he's going to give solutions to people because I don't believe he leaves us unprotected. I don't. I think that we just have to pay attention and we have to open our eyes and our hearts. We have to use our discernment and we have to really understand. And I think you can feel when people are lying. I think you can feel people's hearts. And I think one of the blessings of being friends with you all and working with you all is your true intention is to help so many people, and you are. But I know it is a struggle because I've heard other people, including Clayton, tell me that, what's happening out there is there's a lot of lies occurring as it pertains to what's going on. Yeah.
Yeah. So something that I think is really interesting is, and I've heard it from you, and I know you'll agree with it, is that Western medicine is, 17 to 20 years behind.
Yeah.
And that you bring something to the table that is not just a shot in the dark.
Yeah.
It's not a guess. It's something that you knew about this prior to it coming down the pike. You knew the solution before the problem really hit the table. And you're not just coming out with things that are sort of a guess. And we're hearing some of those. And I really credit a lot of these doctors for wanting to do better, right? They want to bring a solution. They're not quite sure what to bring, and they're doing the most amount of research they can in the moment. But the problem is, again, we're still 17 to 20 years behind. So I would say, could you just speak a little bit about how your background and your research brings forth things that are not synthetic isolates? We have some like nanokinase or nicotine that are being promoted, and I'm not saying they don't help, but if you don't have, if you're using something that's not bioavailable to the body and something that's not nutraceutical, you could be doing more harm than good, or you could just be lacking in what is needed.
Yeah, or lacking in knowledge to understand. Like, I think there's some people out there that they really are regurgitating what they've read or what they think, but they're not really exposed to it. And so, yeah, I will talk about that. I was, pregnant with Preston, working on a project at Camp Pendleton, for example, in San Diego, working for a pharmaceutical project where I was placed in a position to get to hear about different fleas and ticks and different things that were happening, which, were carrying certain diseases, right, or viruses that could be used for the benefit of our country, but if reversed could hurt, our country and other countries. I listened, I paid attention, I took a lot of notes, I learned as much as I could. And my whole thought process during all of this, and this is going back, 24 years ago, my whole process is how can I help with this, or how can we fix this as scientists? I don't know if you guys know this, during Germany, the scientist, and my grandfather came from, we didn't know until later, but the Middle East to Germany and then to the United States, right? Your scientists in Germany, I mean, they were, unfortunately, and this is not a lie, this is not a conspiracy theory. This is the truth. They were taking like crabs and animals and trying to mix them with humans. They were taking arms off of people and putting a crab claw. This is one of the things that they did. And if you look at the history of New Orleans, I remember I was in a class at one of the pharmaceutical companies. I don't want to mention which one, and they were teaching us about the different things that had happened. And I was in shock, right? I was just in disbelief. But I still remember sitting there and thinking, this is so evil and this is so bad. What can we do as scientists to fix this? What can we do differently? So when you're talking about bioprinting and you're talking about cloning, it's very possible to clone a brain. It's very possible to control emotions. But what do we do about it as a Christian scientist? Because most of the people that I worked with didn't have my same belief. And what can we do to reverse some of the negative side effects of nanobiotechnology, of bioscience engineering? Because we have to remember this. People think of doctors and scientists as healers. People think of doctors and scientists as good people. But the truth is, and I know you guys know this, just like a preacher can be good or bad, unfortunately, scientists and doctors can too. So this whole time when I was exposed to all these different things and all these different projects, I was thinking, how do we reverse it? And another thing I actually haven't talked about is I was a CEO of a company that did interoperative monitoring. It's where you put impulses on the body and you energetically read through a system if someone's going to hit an artery or a nerve before they do it in a brain or total joint surgery. When I got into that industry, it was the year 2000. So I'm working for pharmaceutical and biotech. My ex-husband and I started these companies. I started writing papers on how energetically we could read in surgeries and how we could diagnose something before it happens. That is now standard of care throughout the world. That is something they use for brain and total joint surgeries, ear, nose, and throat surgeries, so they don't hit it. People can grasp that, but they can't, and that's just reading the energy levels, right? But they can't grasp a scientist that's able to understand how to reverse the energetic levels that are hurting us in our body, yet she's the one that was studying it and doing science and businesses in that area. And if you ask me why I got into the businesses, it's because I understood in order to have influence, I had to understand both worlds. Mm-hmm. So, I don't think any of this was me. I think that I was placed in positions, and I'm being very honest, and this is not me being humble. This is me being honest. I was put in positions where I think I somehow, probably through lots of lessons I've learned and by failure, I understand that that's not me, it's God. And I understand He did need me to learn these things. He needed me to stay in school. If you ask me, am I exhausted from staying in school? Yes. Like Ted Baker or Clayton will come in and I'm writing a paper trying to get scientific information out there to Africa, right? Do I want to do that? No, but you know what I want to do? I want to create solutions so we can have better doctors and scientists. I want to create solutions so that during the pandemic, we're able to get rid of the things inside of our body. So my major thing when I created these formulations was to shut down the communication, whether it's a spike protein or graphene or 5G or whatever it is, so that you can raise the way the body is supposed to be, support it so it's functioning at an optimal level. So that's so easy for me to understand. It's harder for me to communicate. But I can tell you that if a scientist that worked in interoperative monitoring and worked with human monoclonal antibodies and cloning and bioprinting and ran businesses and was involved, if she can do that, she can do natural supplements that are helping people throughout the world. But she's not the answer. It's God. So the thing that people need to understand is it's not me. I'm playing my piece of the puzzle, and I'm hoping that everyone around the world is going to play theirs so that we can bring light into a pretty dark time in our world.
Wow. Yes. So my hope is that we can reach other providers, and whether those are MDs, health coaches, naturopaths, functional medicine doctors, that we can bring this information to them. They've already started the research, but this is a next level, a higher level. And I'm hoping that we can bring more of those together, because I really feel it's important for every mother out there, every parent out there, every person out there that is facing an illness or a disease to have a really good resource. They shouldn't have to do this on their own. They shouldn't have to be the researcher. Shanna and I both went through that ourselves, and that's why we're here in this position. But I really hope that we have an amazing list of providers that we can hand off to people that understand what you're bringing to the table, and how this can help people, how it can truly help people from a natural standpoint. And I know you're talking about getting this into hospital systems. I'm really excited about that.
Yeah.
So,
yeah. Yeah.
The future's on its way.
Yeah, that's my hope too, because I noticed that, again, that the arrogance piece where doctors are wanting to argue or wanting to be mad because they don't come up with a solution. That's not how it should be. I don't have all the solutions either. We've got to work together to really come up with these things. And you're right. We are, getting registered and certified in Saudi Arabia and the Middle East and Asia, all over, where some of those countries are more accepting of natural supplements, right? Some of those countries understand silica and zeolites and how you can work with them and create different energy levels that help basically rip things apart in the body or shut down communication. And I want to say this as a bioscience engineer and a nanobiotechnologist, sometimes you don't have to break something apart. I do know that I have formulations that, I know we talk about a lot with Clean Slate, that are able to rip things apart. Sometimes what you have to do is energetically shut off the signaling. There's no communication, and so it dies. It's lifeless, right, in your body. But then you've got to figure out a way to carry it out of the body in a safe way. And I think that's where our products are different. Being able to work with the land, air, and water and getting patents through and being able to really break things apart in the air, that's hard, right? Or the land or the water. But then when you look at the human body, it's actually a little bit easier to do that if you understand the mechanisms and how to develop them. And that's where we have some solutions. It's interesting. We have things that cohesively will work for the planet, people, and pets. And I say that all the time. I know it makes people mad. They're like, well, how can you do all of it? Well, because I'm a bioscience engineer. And I understand how to work with different molecules and isotopes and isolates, and how to basically make things interchangeable or to shut the signaling down through an IL-2, IL-4 pathway or P450 pathway, right? And that's important, because your P450 pathways are carrying diseases and viruses, and they're communicating and causing issues. So the fact that I understand those pathways, I studied those pathways, I worked on human monoclonal antibodies, that gave me an advantage, but for one reason. That gave me an advantage so I could help people, not so that I could be arrogant or think that I know more. So hopefully we'll be able to get that message out, and we'll find more people. I know today in the doctor to doctor call, we had an incredible meeting, and I know we're getting a lot of press worldwide for how we're able to help people. And again, that does not go back to me. That goes back to the work you guys are doing and your groups are doing to really help people.
Well, we hope to fill those doctor to doctor calls for you monthly, so almost the need to have them weekly if that's the case, so that we can get more and more information out there. I would love that. But I do know how busy you are, and I do know that you're traveling the world, and I think that's really important to note, because the U.S. is a little bit behind, and I love what you're doing across the world for those that are open and willing and ready to go, that you're stepping up and partnering with them. I love that.
Yeah, I'm not a fashion designer. If you guys see me on social media, I understand that our skin is our largest organ and one of our most important organs, right? So we've got to protect it. And that's what I love about us all stepping up and providing multiple barriers for the world. So we're breaking things apart. We're shutting down the communication inside the body. We're cleaning it out. And at the same time, we're providing barricades so that things can't get in our body. And that's what we really need to tell. This is a story that's not something that has to do with one thing. It's about the whole miracle of the body and how we're supporting it.
I love that. That's wonderful. That's a great ending to a perfect interview. And I'm so grateful that you joined us today. I have to say, I'm so grateful for you as a friend, but I'm also grateful to know that there are doctors out there that are doing amazing work, and that we will have access to that, because for decades we didn't. And I'm extremely grateful for that.
Thank you. I'm grateful for you all, and I mean that sincerely. I am so very thankful, and for your groups, because I know that it's not, you guys are leading and you're also serving, and I am too, and that's what we all have to do. So thank you so much, and thank you for giving me the time to be on the call.
Thank you so much.
Thank you.
Thank you. Bye.